cross matching, I can do O negative. But there is a new update now in 28th edition Bailey. 28th edition Bailey says a new update. Please remember, O negative is a rare group. We cannot go for O negative everywhere. Therefore, 28th edition says in males, we can give O positive itself. In reproductive age females, in reproductive age girls, I should give them O negative. What about postmenopausal females? Postmenopausal females also you can give O positive. Postmenopausal females also you can give O positive. See, why we are worried about O positive? Because if I give positive blood group in an Rh negative woman, the baby can get Rh incompatibility. That is why we don't use this group in reproductive age group. Please don't forget, we should not use this in reproductive age group alone. Therefore, reproductive age group, the new update is O negative. In males and in postmenopausal females, you can give O positive is a new update. Please remember the answer for this question is positive because it's a 23 years male. Okay, this is a new update from Bailey and Love 28th edition. Don't have any confusion in this. So O negative is a universal donor, but if they mention male or a postmenopausal female, go for O positive. If they mention as reproductive age girl, so for example, this is a 23 years girl, I would have definitely went for O negative, but this is a 23 years male. Okay, don't forget fourth question. This question is a AIMS question asked already, so there is high chances this can repeat for you. Mrs. Rani was about to be transfused blood. The blood bank medical officer gives this tube to the CRRI for transfusion. What is this? What is this blood set? This is a different type of blood set called as, if I tell the name, you will tell the answer. The answer is B, leukocyte reduction filter. Leukocyte reduction filter. So please don't forget, this is a special blood transfusion device which is not commonly available everywhere, but it is called as leukocyte reduction filter to prevent WBC induced reactions. Don't forget this. It is used to prevent WBC induced reaction. So what is the most common complication of blood transfusion? If you know the answer for this, that is the reason we are using this. Most common complication of blood transfusion. Most common complication of blood transfusion is non-hemolytic transfusion reaction. As soon as you do the blood transfusion, patients will have chills and rigors. So patient will get chills and rigors immediately after you transfuse the blood. It is because of the WBC present in the donor blood. WBC in donor blood. Therefore, it will be good if you can give this filter. If you give this filter, it will filter the WBC, not allergic. It is not an allergic reaction. Please understand, it is non-hemolytic transfusion reaction due to WBC in the donor blood that is causing this chills and rigor. Therefore, if I use this filter, patient will not have chills and rigor. That's a simple question. So what is the common complication of blood transfusion is the FMGE question. It is non-hemolytic WBC induced transfusion reaction. We use this leukocyte reduction filter. Don't forget, this is a blood set. Okay. Mr. Munusamy, 65 years male, had an acute urinary retention and presents to casualty. The postgraduate resident inserted a Foley's catheter of 16 French size. So 16 French will have this color. What is this color? 16 French is having orange color code, orange code. These pictures are orange code catheter. 16 French is used in males. So, and the postgraduate has insufflated this balloon using a normal saline. Please don't forget, that is a wrong method of insufflation. How will you inflate this balloon? The balloon should be inflated with distilled water. Okay, don't forget this. It should be inflated with distilled water. This is a wrongly done procedure by the PG student. The patient came back after 45 days. You are unable to deflate because the normal saline has crystallized in this channel. Because of the crystallization, now I am unable to remove the catheter. Because I am unable to deflate, so I am unable to remove the catheter. What will you do now? Cut the Foley's and remove. Overinflate the tube and rupture. Under ultrasound guidance, puncture the balloon, push sodium bicarbonate inside. The ideal method is a recent question. See, whatever I'm putting 30 questions are all AIMS questions which are asked in the exam. So all these can get repeated for FMG exam. So please go through these questions. Under ultrasound guidance,